at cardiovascular disease and the risk factors that come associated with it, obesity is a very, very strong risk factor. And why is that? Because obese people have a higher chance of developing diabetes and many other issues. And one of the most important concepts that we talk about is metabolic syndrome, and that has a huge link with obesity and cardiovascular disease. So there are multiple various models that are available, but the most common ones that are usually used by both the the Cardiovascular Society as well as Obesity Society are two things. One is the Framingham score, which is, if you Google it, you should be able to find out. Also, after this came up, what came out was the American Cardiologist Center score, and that, or the ACC score, it's more commonly known as. And both these scores have a risk mitigation, and they give you an exact score of what is the possibility of a person developing cardiovascular disease. And using these risk factors is the base with which many studies are being done all around the world today to see if modifiable risk factors can be altered, and patients can reduce the chance of developing a cardiovascular disease. Many of these patients, they realize that, the weight has been a major cause of concern to them only after they've, suffered a possible cardiovascular attack. So we've done a lot of patients, done a lot of surgeries on patients who have already had a stent placed in the heart or even a bypass surgery done in the past. So it's pretty common because these days we're seeing younger patients also developing this kind of cardiovascular disease. So they want to reduce the weight and try to negate the risk of another attack later on in future. So yes, it's very, very common these days. Bariatric surgery works a lot on the modifiable risk factors. And what are these? Like things like when you tell a patient to lose weight, cardiologists routinely tell a patient to lose weight, but bariatric surgery's principle itself ideally is to lose weight. So it really acts upon the patient's weight. And because of this, the chances of resolution of diabetes, the metabolic syndrome, hypertension, and many other factors come down. There have been enough data also to prove that the chances of developing these plaques inside the blood vessels, which is why a patient develops a cardiovascular disease, comes down significantly after a bariatric surgery. Another important factor, which we've also found out in many studies, is the actual function of the heart improves after a patient undergoes bariatric surgery. Now, these are all results that have been done both by the cardiologists as well as the bariatric surgeons across the world, and has been published data. And there is enough evidence now to say bariatric surgery has a huge role in reducing the risk of one's chance of developing cardiovascular disease if they are obese. People have already had, as I mentioned before, yes. So people have already had a cardiac attack, and then they've had a stent inside their hearts, or they've undergone a CABG. Now, what happens in these patients is the chances of them developing a second attack, wherein they may have to replace the stent or sometimes go for a redo CABG or a CABG procedure, really comes down if they start to work on these risk factors. Now, how do you work on these risk factors? One of the important ways of doing that is to reduce one's weight, and bariatric surgery principally does that by various methods that we all know of. So definitely it plays a huge role in preventing a second attack on patients who already had cardiovascular disease. Off my head, just quickly, one patient which I recently operated about a year back. So I know the results right now, so I can easily talk about this patient. So this was a person who's about 56 years, is a male, and he had his a triple vessel disease in the heart about 6 years back. And he was obese. His BMI was about 45, and he had gone and placed a triple vessel. Three stents were placed basically in his heart after angioplasty. Now, even after this, he wanted to really lose weight after that point. But his weight was also causing a lot of concerns because he was having knee pain, low backache, and many other issues. Now, when at a point where he wanted to really lose weight at any cost, he was referred to me by a friend of mine, and then we did a Roux-en-Y gastric bypass on this patient. And today his BMI has come down from 45 to about 33, and he's lost a lot of weight and he's feeling much more comfortable. The most important factor here is both his lipid profiles, which were on the higher side, his diabetes, his HbA1c levels, which were about 10.5, now has come down almost to normal in this period of 1 year. So his chance of developing a blocked stent in one of his vessels that he had stented before is going to be very, very less now when you look at the scoring. So these are life-changing surgeries, and these are surgeries which, done at the right time, actually can really reduce the risk of one's development of a cardiac issue. I'm a firm believer in two things. One is, I think if somebody is able to lose weight with their own methods, not by depending upon medications, but depending upon a good diet and exercise, and sustain it for a significant period of time, there's nothing like it. But unfortunately, people beyond a BMI of 35 or 33 with comorbidities are unable to sustain it over a period of time, and they start developing multiple comorbidities. Now, when somebody is not able to do that, that's when bariatric surgery needs to be projected up as one of the next possible choices. But today, in our scenario in India, still bariatric surgery is looked upon as the last resort, wherein these patients come to us with multiple problems which they have gained because of their obesity over a period of 10-15 years, and we are unable to give them the best results. Yes, our results are great. Now, the same gentleman, if he had come to me, say about 10 years prior to him undergoing the angioplasty, probably he might have not even required a stent initially. He need not have gone through a pain. The family went through a pain. He was stressed. His family was stressed. So many factors play a role. And I think people need to be educated that weight loss by bariatric surgery is not a bad thing. It is a very much physiological method, and there is enough results to prove this. And people education and these platforms and must really be used well to educate people, as well as a lot of physicians as well. I honestly also think many physicians need to be educated really well about what bariatric surgery exactly is, and what are the results of this, and whether it's going to cause them a lot of side effects or not. Bariatric surgery safety and bariatric surgery is a very under spoken of, because many people, many patients, many doctors, many friends of mine who come to me, the first question that they ask me is, yes, I know I am a candidate for bariatric surgery, but is it safe? Now, this question is possibly a better question if it was asked, say, about 15 years back or 20 years back. Today, with so much of standardization of techniques, there's so many good equipments that are available. The staplers that we use are all very high-end staplers and very good staplers, which are reducing the risk of any side effects or complications that come associated with bariatric surgery. Number one, the techniques are very much standardized. Now, the limb lengths that we use for the procedure are very much standardized. The bougie that is used is very much standardized. So you are reducing the risks of any complication in bariatric surgery by standardizing these techniques. If you actually look at it, the complication rate, the average complication rate of bariatric surgery is much, much lesser than one of the most commonest surgeries that are performed in our country, which is the CABG or the cabbage procedure. Now, that itself is a very, very clear indicator that this is a very safe surgery if it is done on the right patient, if it is done, the right procedure is done on the right patient and at the right time, and all the pre-operative, the intraoperative, and the post-operative details are taken care of. This is one of the best surgeries and the safest surgeries that you can find.